To find the brachial plexus, you put your probe in transverse over the clavicula and you will find this picture. Medially, you can see the supraclavicular artery lying on top of the pleura, and laterally to it the first rib. The pleura and first rib appear as hyperechoic lines. In the upper part of the picture, you'd see from lateral to medial the suprascapular nerve, the posterior division of the upper trunk, and the anterior division. Under it, there comes the medial trunk and the C8 nerve root. The medial trunk appears like a bunch of grapes, and the C8 nerve root more like a hypoechoic round structure. When you toggle your probe in a more caudal direction, you will see how the suprascapular nerve moves more laterally under the omohyoid muscle. The muscles on both sides of the brachial plexus are the medial scalene muscle and the anterior scalene muscle. In this shot, you can see the typical location of the C8 nerve root that normally lays on the first rib. So maybe you ask yourself, why is it not upper trunk, medial trunk, and inferior trunk? It is because we have an oblique view on the brachial plexus. Therefore, I put this little scheme on the lower part of the picture. The red line shows our ultrasound view. From top to bottom, we can see well the upper trunk and the suprascapular nerve. Then comes the medial trunk and C8 and T1 root that only later form the lower trunk. Sometimes you can see T1 and even the lower trunk when you toggle your probe in a more caudal direction. But T1 and the lower trunk are usually more difficult to see. Thank you for watching.